Very good evening, friends. We'll start today's session, the last concluding part of the examination of the patient from Stuart Close philosophy. Many aspects regarding the examination of the patient he has tried to explain in this chapter. He has explained how to go ahead, what is important from homeopathic point of view, which symptoms you have to look for, which are essential from your point of view, which are essential from diagnostic point of view. All those things he has tried to correlate along with what is the importance of history taking. Then he has explained regarding the mm, clinical examination, the importance of clinical examination, everything he tried to explain. And to conclude the chapter, he has started with the importance of clinical history. And in the clinical history, the past history, the significance of past history, how it gives you a miasmatic interpretation. Then the family history, also it is very useful to understand the miasmatic conclusion. All those things he has tried to explain over there. And ultimately, last, he has explained how should be your clinical form. See how minute details Close is explaining. He is explaining how your case paper should be. Because if case paper is properly developed, then you never miss anything in the case test. I have given nearly about 4 hours time to create my own case paper. Because unless and until we have that printed format, it is not possible to go ahead with the cases. Otherwise, we miss many things. If we take case on printed format, then it happens that after whatever the patient narrates, we can go to each and every point and we can find it out what is remaining over there. So every aspect of case taking is having an importance. And that's why that thing he has mentioned over there, that you should have your own printed form. It should not be very small size. It should be of a proper size. He has given the size of it also. See, these are the people's how they use their knowledge and explains that how their student should gain all those things that he has tried. And he explains standard letter size sheet 8 into 10 gives plenty of space, match ordinary correspondences and fit the standard vertical cabinets. So that case paper, how it will be useful, how it will, you can file it and it will be remain in vertical cabinet. What is the need of giving this thing? But still, this fellow gives it for you only for the purpose that you should get the success in your life. Then he explained the examiner should be constantly on alert and observing while making an oral examination. Alert word is very important. Alert should be the rubric of every homeopathic physician. There is a cross reference to this rubric in the repertory, quick to act. And homeopath should be in a condition quick to act. Because whatever is happening in front of you, you should be able to catch. If the patient is coughing in front of you, you should be able to understand how he is coughing. Whether he is coughing in single paroxysms, whether he is coughing in two paroxysms, whether he is coughing in two paroxysms in successives, all those things that matters. You should be alert. That is what is nothing called as a sound senses. So whenever you are taking the case, you should not look down, but you should look toward the patient and observe what you are getting. Observe or listen what he is saying. Everything matters to understand that patient, and that's why the you should be constantly alert and observing while making an oral examination. The patient may be unconscious or delirious or an infant, unable to talk or insane. Sometimes it happens we get the patient unconscious. I have seen one patient in ICU at Nasik. They were relatives of mine, and we just went over there, and patient was uh, admitted in the ICU hospital, in the ICU of the hospital, and since 8 days he was in coma, no response with all mannitol antibiotics, everything was going on trial basis, nothing is working. and even steroids were given, nothing is working. They labeled that patient is having encephalitis. And this has happened. This might be possibility of infection. That is the only thing they can answer, but they don't have anything to explain it. And I have seen that patient was lying like this on the bed, and he was in unconscious. You should be very watchful. The patient is slanting on bed. His mouth is wide open. It is the fluid is dribbling, and patient is in comatose state. So much prostration. If it is because of some infective focus or some fever, remedy is very important. I have given to that patient the muriatic acid. I asked the permission of that physician, and he said, "Sir, it's your patient. You can give. No, don't worry. We know that we are helpless. We don't know whether he will come out or not. Why not to try?" And we have given muriatic acid. After giving muriatic acid, 30 or 200, I cannot recollect. It's way back. But after 1 hour, patient has opened his eyes after 8 days. And within next 24 hours, he was absolutely normal, became conscious. Then he was saying, "Why you have brought me over here?" He was not knowing anything. So this is how it works. And that's why you should be very attentive in observing. Even patient is unconscious, you can get the things if your eyes are open. He may be malingering or trying to deceive us to the real nature or cause of his disease. Sometimes patient exaggerates their symptoms. That also you should able to find it out. And that's why you go with sentence by sentence. In the follow-ups, what happens? Patient, if you ask the patient, "How are you?" Patient said, "Nothing, doctor, no change." Then you start asking the first symptom, how it is. Much better. Second symptom, much better. And then you are saying nothing wrong, nothing doing. So patient may be malingering, patient may be explaining certain, or they're trying to exaggerate their symptoms. You should be watchful to catch that. Knowledge of the natural history and phenomena of the disease will aid in forming the true picture of the disease. So you must know each and every disease prior to take the history. That's why there is an importance of understanding the medicine. If you understand medicine clearly, you should be able to treat each and every patient. And that's why my suggestion to all of the students of homeopathy, go through the Davidson books at least 10 times. I used to word 10 times because I have read it 10 times when I was in fourth year of VIHMC, and 11 times when I was doing PG. But that gave me so much of confidence because I was knowing the disorders. And it's a wonderful book which covers many disorders. As a prescriber, the homeopathician is always seeking that in the case which is peculiar, common, uncommon, characteristic, individual. So for you, the characteristic symptom plays a vital role. Common symptom doesn't give anything. Patient comes to you complaining of pain in abdomen, vague symptom, nothing works. But patient comes to you with very specific symptoms, very important. He says that, "Doctor, there is a severe pain in abdomen. I could not bend. I just have to extend myself, and then only I feel relief." You are getting the modality. What is the remedy? Severe pain in abdomen, better by aggravated by bending forward, better by extending the body.
Diascoria.
Yes, diascoria. Correct. Very correct. Very correct. Diascoria. So how you know that diascoria? Because you have got the characteristic modality, the peculiar modality. Without that, it is not possible. And that's why he is explaining that may be noticed, may be noticed in some casual expression of the patient as he talks, revealing his mood and state of mind or the origin of trouble. It may be found in the color, form, or expression of his countenance or in his attitude, gait, or physical demeanor. So you can get this peculiarity anywhere. You can get this characteristic anywhere. You can get it on the in the specific color form, in the form, in the expression of his countenance. Patient comes one of day, and he came to me, and early in the morning, around 9 o'clock, and this fellow, around 22, 23 years of mm, person, fellow came to me, and he was having, doctor, today I was, I went to for passing stool, and there was something, living creature came out, and he was so frightened, looking toward that worms. The expressions were very important. He was having the worm, but expression was as if he has seen the lion. So what we are going to prescribe?
Econite.
No. Another very important rubric which you can catch over there. It is not Sina. It is fear extravagance of. Single remedy is opium. It is beyond limit, fear beyond limit, fear extravagance of. Single remedy
Opium.
Yes, correct, opium. So this is what you have to catch. On the patient's countenance, you have to catch what he is expressing. So this is what he is explaining over there. You might get it anywhere. It might be in the gait, it might be in the physical demeanor, it might be in attitude. How the patient enters in your clinic, that also matters. That gives you identity of that individual. Every individual approaches you in your clinic in a different manner. You understand the attitude of the person with which you can catch a remedy. So everything matters, every minute thing matters. And that's why all those points which he has explained, that his mood, his state of mind, it that gives you exactly the nature of the person. Patient is there, comes to you, and he says, I went to that doctor, whether he is a doctor or same, yeah, what medicine he has given, and he has, because of which I am suffering a lot. What is the feeling? What is the feel behind that? What rubric you can catch? He's explaining you something which is very essential for you to catch the theme. Why he is talking about that doctor in such a manner, why he is blaming that doctor regarding his present problem. So delusion wrong has suffered. Then you get only 4-5 remedy. Then you have to differentiate only. So you have to understand the feel, the patient's expressions. All things matters. If the patient is confined to bed, the examiner will observe his position in bed. That's what I have explained regarding the muriatic acid. Open your books and look into the muriatic acid. You are going to find same posture. His manner of moving and turning, his respiration, the state of his skin, color, the odor of perspiration, the odor of exhalations from the mouth or body, physical appearance of excretions, relations of the patient's sensations to the atmosphere, and the temperature is shown in amount of covering, ventilation of the room, ice bags, hot water bottle, etc. And all these and many other little points noticeable by the alert examiner, perhaps without asking a question, will be valuable guides in the choice of remedy. They should be recorded as such. And this is what is called as attention in observing. You are called at the midnight to see a patient who is suffering from asthma, and they are not able to bring him to your OPD. And he was absolutely severely breathless over there. And he was lying in bed like this, and he has covered whole body. Only this much is opened, the windows are completely closed, and he's lying like that, and he was breathless tremendously. And it's a summer. What remedy you are going to prescribe? Any idea?
Turinum.
Correct. Correct.
Turinum.
Yes, it is sorinum. Patient lies with hands wide apart, absolutely chilly patient. Even in summer, he covers his body, lying in the bed. No asthma patient lies in bed. Generally, asthma is orthopnea is quite common, but sorinum it is exactly opposite. So you have to catch those things. These are called as characteristics. Where remedy is hidden, you have to understand what is there with which you can approach and with which you can catch the remedy. The things are very essential. So it is hidden either in sensation, it is hidden either in modality, it is hidden either in concomitant, anything, but that you have to catch. And this is hidden everywhere. So physical appearance of his excretion, sometimes that also gives you a remedy. So patient, you go to the room and there is a tremendous strong smell of urination happens to be there in the bed, and patient is lying over there and it is very strong. So you should come to some remedies which are having very strong smelling urine. We have learned just now. One is benzoic acid, second is nitric acid, very strong smelling urine. So these are things which guides you towards the things. If patient is there, you are examining and his sweating is there and that odor is a sweatish odor. You catch that, yes, it is a sweatish odor. So which is the remedy where the odor of the perspiration is sweetish?
Thuja.
Yes, thuja. Very correct. Thuja. So these are things which you have to catch. These are things which guides you towards the individuality. The mental state, conscious and subconscious, is revealed by the general behavior, the conversation, the expression of countenance, the desires and aversions, and the manner of sleeping, as well as by the voluntary verbal expression. So where you get the individuality, you get it in mental state. Patient comes to you in such a position and asking you regarding this, then you catch its condition. Patient comes to you and patient mm, patient is telling you, doctor, I'm having hair fall, and he's explaining, doctor, whether I will get bald. See, this is very important. Patient is getting hair fall and he immediately considering that he may become completely bald. Here the mental state of the patient is he is expressing. It is again the same, the fear extravagance of, that is the opium. So you have to understand the patient's behavior. Some patients comes, they are very relaxed, talks to you very mildly. So that mildness you have to catch. The politeness you have to catch. The desires and aversions matters a lot. It should not be. If you ask, how do you like sweets? Yes, doctor, sometimes. It doesn't have a significance. Doctor, without sweet, I cannot stop. Every time, at least little bit sweet should be there, otherwise I could not eat. This indicates that there is a craving for sweets. It has a meaning. So every symptom has its own meaning. If patient says, what do you don't like? Doctor, I don't like milk. I never looked toward the milk. It has a significance. That you have to catch. Manner of sleeping, different positions are mentioned. Open sleep chapter in cancer repertory and just open the positions and you will get plenty of positions mentioned over there. How the pulsatilla sleeps, how the sina sleeps, how medorinum sleeps, how kalikap sleeps. Then you get as that is also important indication which will guide you towards the remedy. Mental symptoms are of highest importance. Expertness in observing and analyzing these features of the disease should be cultivated because right conclusions and effective treatment often depend more upon the physician's own observations and directions than upon anything that others and even patient are able to tell him. So most important thing is that patient will not able to, if you put him question, how is your mind? No one will say, doctor, absolutely bad. I am a dirty man. No one will going to tell you this. Then how can you get the reality? And that's why Hahnemann have utilized one word. He said perceiving power. Perceiving means it is just observing, listening, and you perceive from that communication how the person's nature is. That's why physician's observation it plays very vital role in understanding the mind of the person than asking him how is his nature. No one will going to give you reality. In the matter of mood and temper of the mind, for instance, he will be able to judge from the patient's manner of relating and expressing his suffering and his behavior towards his attendants, whether he is sad or cheerful, calm or anxious, confident or afraid, indifferent, morose, censorious, malicious, irritable, suspicious, and jealous. If you open all these are the rubrics, my suggestion to all of you is go through the Kent's repertory, go through all the rubrics, and then you will find that this is there in the repertory. Then you have to find it out exactly the meaning of each and every word. So, what is censorious? Anyone, what is censorious?
Fault finding, critical.
Fault
Yes,
finding.
correct. They are fault finding. Censorious is critical. They always just finds it out what is wrong with others. That you have to catch. These are the people who catches all those things. They never looks toward the positive side. They always look toward the negative side. And they are able to catch that very easily. Fault finding. So you must know meaning. What is morose? Morose म्हणजे काय?
Bad tempered, sadness.
Sadness expressed on his countenance is morose. It is morose, which is extreme sadness, which is expressing on the face, in his body language, is the morose. Then you should be able to catch that moroseness. Yes, this is the rubric of the patient who is sitting in front of you. If you ask whether you are sad, the patient will laugh at you. You are observing that he is sad, then you have to understand that sadness is coming through his countenance. That is morose. So every word has a meaning, and that you have to catch from the patient. So see how the patient his behavior in the clinic, in your consulting room matters a lot. How he approaches towards you, how he gives history to your attendant or to your doctor, how he talks with you, how he talks with the receptionist. Everything matters a lot. There are some people who comes in your OPD. Tell doctor I am there in the waiting room. What is the rubric you are going to take? You can listen at the inside. He talks so loudly that his aspect is that you should able to find it out that he is there. What is the rubric which you are going to collect?
Haughty or egoistic.
Haughty or egoistic. Egotism, okay, that is egotism, but egotism is a big rubric. You will not going to come to conclusion few remedies. You will get many remedies. This is called as pompous.
Pompous
Yes.
importance.
Pompous importance. He's showing, yes, tell doctor I am there. Importance fills is pompous. That is the rubric. Pompous, I am someone. Pompous. That is what you have to catch. He talks like that. And when he enters in your clinic, opens the door. Doctor, may I come in? See, the nature has changed. There he has expressed like this. Whenever he is entering in your room, doctor, may I come in? And then his tone has down. So again, you have to catch his behavior. What is that? Rubric.
Hard to inferior, soft to superior.
Correct.
Hard
Very,
for
main
yes.
rubric is, it is not given like that. Main
Soft
rubric,
for-
Hypocrisy.
no, whatever she said is very
soft
correct.
for superior, hard for hard.
It is contemptuous, hard for inferior, kind to superior. Main rubric is
Kind to-
contemptuous. Under contemptuous, it has been given hard for inferior, kind to superior. So see, just observing the behavior of the patient gives or guides you towards the remedy. And you should be very watchful regarding all those things, because mind, you should not ask, you should perceive. And this is what he is expressing. I think we'll stop over here because this is more practical session. On Monday, there will be no class. We'll meet directly on Tuesday, most probably. And we'll finish chapter on that day. Today it is still, I think it will require one more lecture to conclude this chapter. So we'll meet again on Tuesday. Tomorrow and Monday there will be no class. Okay. Any question? Any query?
So 8 o'clock,
Correct question.
8 o'clock class.
Hi, 8 o'clock
Hello.
class is there. Remedy? Carbo veg. Today's remedy is carbo veg.
In the cannabis sativa, first sentence was said that the sensation as if dropping of water from single part.
I could not
Ca-
get the time. I will go through it and I will let you know. There is a remedy, but I will I have to go through that. What you have asked.
Can we take the single point and prescribe the medicine, sir?
You can generalize and prescribe. No, but there is. I have just now read. It is not only just urethra, that dropping of water from the from any part. It might be a cantharis, cannabis sativa. I could not recollect, but it is most probably it is the cantharis or cannabis sativa. The same sentence is there. It is not just from urethra.
It is cannabis sativa, first sentence it is.
It is there.
Yeah.
I am
Okay.
not possible to go through the repertory today because of OPD.
Okay. Okay.
Yeah. So,
Excuse me, sir.
yes, sir.
Hello, sir.
Can I call you after the class?
What?
Shall I call you after
Ye-
completing this class?
Yes, sure.
Thank you.
Anything
Correct
else?
question आहे. मोरोस पर्सन माइल्ड असतो का?
काय?
Hello, sir.
बोला.
Can morose person be mild? मोरोस पर्सन माइल्ड असू शकतो का? कारण एक्स्ट्रीम सॅडनेस ते फेस वरती शो होतो
You
मोरोस
cannot.
मध्ये.
It doesn't indicate mildness. Mildness is
नाही,
different and morose is different. Whenever person is in a morose
हा,
state, he
ते
will
एका
never
person-
react. He will not going
अच्छा,
to
हा,
react
हा, हा.
in
हा.
morose state.
ते
And
आपल्याला फेस वरून कॅच करावं लागेल.
that you have to catch. Whether when you go on taking the history, then you can catch. Otherwise, not. Okay.
So how to DD morose and pathetic, sir? Pathetic and morose.
We'll let you know tomorrow. Tomorrow, no, on Tuesday's lecture, because I have
Thank you,
some
sir.
appointment. We'll definitely discuss
Yes,
that
sir.
on Tuesday's lecture, not Monday, Tuesday's lecture. Okay. Thanks a lot.